So I think, we want to look at the efficacy of these drugs. How effective are they? EV-Pembro seems to be fairly effective. It's clearly outperforms standard platinum-based chemotherapy. We have to consider the specific toxicities of these agents. And while the data, I think, is pretty exciting for EV and Pembro, there's a significant rate of neuropathy. About 50% of patients experience some degree of neuropathy. 25% of patients get grade 2 neuropathy. And that's significant neuropathy in the sense that it interferes with daily activities. They might not be able to zipper their jacket, button their shirt, use a utensil, drive a car. And that, I think, is a big challenge for our patients, because of course we want to give them the best therapy we can, but we don't want to leave them functionally debilitated. And so close attention, for example, with EV, to dose is really important, to dose reductions, dose delays, monitoring, educating not just the doctor or the nurse, but the patient and their caregivers to really understand what's going to happen. There are other side effects to EV, like rash. It can be mild in most cases, but some patients can have severe rashes, like Stevens-Johnson syndrome or toxic epidermal necrolysis, and those can be fatal. So I think recognizing rashes early, treating them with topical steroids, oral steroids, getting dermatology involved are important as well. When we think about the agents that have the topoisomerase payload, so these act very much like irinotecan, which is an approved chemotherapy, so they're myelosuppressive. So we have to think about neutropenic infections. And in fact, one of the criticisms of the TROPiCS-04 study of sacituzumab was that GCSF, growth factor support for white cells, was not mandated for all patients. And in fact, there were neutropenic deaths on the study, actually a fair number of them. So we have to think about the myelosuppressive effects of SN38 or irinotecan-like payloads, as well as the GI side effects. It can have severe diarrhea, and there can be other side effects as well. With HER2 targeting, we see maybe some less side effects. Nectin-4 is primarily expressed in the skin. That's why we see so much skin toxicity. So with DV or with trastuzumab deruxtecan, we're not really seeing the same degree of skin toxicity. We do see the neuropathy because the payloads are the same. At least for DV, it's the same payload as EV.